Hello everyone, welcome to the another lecture of pharmacotherapeutics. So today we are going to discuss about 2-3 cases on hypertension as we have completed the topic of hypertension. So today let's discuss a case study on hypertension. Male patient of 52-year-old age working in a corporate office with a weight of 82 kg and height of 165 centimeter appeared in the hospital with the chief complaint of occasional and generalized headache with the dizziness from last 2 to 3 months, and he was complaining of occasional vertigo also. Sometimes he was having complaints like vertigo also. So when the physician obtained the history, what they have got means there was no any non-complaints, non-medical condition or non-medical history. However, when obtaining the family history, the person was having the hypertensive history at a family and his parents were diabetic also. He was having the mixed pattern of diet. He was having non-veg and veg both, and occasionally he was drinking some alcohol also, but he was a regular smoker in the office. So that was his complete history. And during the physical examination by physician, so what was recorded means his blood pressure was 160 mmHg in 96 mmHg in the diastolic. His pulse rate was also 84 beat per minute. So this BP is increased. His pulse rate was in normal range. However, the another important parameter was body mass index. That is, BMI was more than 29 kg per meter square. So doctor has suggested some laboratory tests. In the laboratory test, his fasting blood glucose level was in the normal range. Serum creatinine level was also in the normal range. However, he was having little evidences of elevated low density lipoprotein. So these were some of the findings during the laboratory things. Now, actual questions comes now. So what can be diagnosis of this case, right? After getting all these idea, his age is 52, male person with weight of 82 kg and height of 165 centimeter, right? He was having complaint like generalized headache and dizziness from 2 to 3 months. He was having vertigo. Family history was positive for hypertension and diabetes both. He was occasional drinker and sometimes he used to smoke also. His BP was elevated during the hospital visit and his pulse rate was normal, but BMI was also high, means he was the overweight or near to the obesity. His fasting blood glucose were in the normal range and creatinine level was also in normal range. However, his low density lipoprotein was little high during his lipid profile test. However, other all parameters were found in the lipid profile test. So what can be diagnosis and why this diagnosis, right? See, as we can see, his blood pressure is high and his BMI is high, means he is obese, risk factors are there, his family history is there, he is having some symptoms like headache, generalized headache and dizziness also, and vertigo also. So we can suspect the person is having the hypertension. He may have hypertension, and we are having some additional evidences of increased LDL also. So we may suspect the person as a hypertension, right? What type of hypertension? He is in the stage 1 or slightly starting the stage 2. Rather, it is in the stage 1 only. So according to JNC 8, he was in the stage 1. But in theory, we have discussed that we cannot judge whether he is having hypertension in just one hospital visit. So here, provisionally, we can diagnose him as a hypertension, right? Because there were no any other evidences. However, we can call him in the follow-up after 1 or 2 weeks so that we will again measure his blood pressure. And we can decide whether person is having actually hypertension or not. Right, so what should be our goal here? Our first goal should be now normalizing the blood pressure. We should try to normalize his blood pressure and to reduce the LDL level, and we will suggest person to reduce his BMI. What we will suggest him? We will suggest him to reduce the body mass index also. However, we will try to normalize blood pressure, but we want to call him in the follow-up after a week or 2, so that we will able to get the clear picture of the hypertension, right? So now another question is whether treatment is required or not, right? Yes, if his blood pressure is high, that is nearly up to stage 2, so yes, treatment is required as of now. Again, we will call him in the another visit after 1 to 2 weeks, and we will see whether the treatment is really required or not, then we will readjust or retitrate the therapy, right? Whether it is required or not in the second video. But as of now, we need to give him some medication. So in this case, right, we can give him the low dose amlodipine, we can give calcium channel blocker, right? And even we can go with the ACE inhibitors and beta blockers also. However, only one agent is enough because we don't know whether this condition is there, but we have to educate him regarding lifestyle modification and having mindful diets and all. So all the non-pharmacological measures what we have discussed, we have to counsel him he has to follow the lifestyle modification and dietary modification, although in next visit if his blood pressure is found normal also, but this suggests that he is at probable risk, so that we want to change his lifestyle. So lifestyle, like, right, he is alcoholic, we will suggest him to reduce or quit alcohol. Occasional alcohol also is dangerous, right? So alcohol at any dose, at any occasion, at any instances is harmful. Now he is a smoker, so smoking can be slightly reduced, and over the period of time that can be stopped. And his BMI is also high, so we will suggest him to reduce the BMI. So for reducing BMI, we will suggest him the DASH diet, having more fruits and vegetable with low carbs and fat, and replacing the bulky fats and carbs with the lean and healthy fat and carbs. Then another thing what we can do means physical exercise, right? As in the theory we have discussed about the various type of exercise, aerobic exercise, resistance exercise, dynamic exercise and all. We can suggest him some exercise in the majority of his day in the week. So that's how we could manage his condition by adopting the lifestyle change. And here one another question is what additional test can be warranted, right? So what additional, as it is he is a new case, right? So there are very less chance he may be having the complications, because till now he was not having any complications, right? But if we want to see, we can go with some additional tests. We can go with some additional tests like HbA1c we can measure. HbA1c we can measure, because fasting blood glucose only will not give the entire picture of diabetes. As he is having the history of diabetes also, we want to check his HbA1c level also. And if it is required, because serum creatinine is in normal, however renal implications are very less, however we can repeat the test in the next visit, right? This is how we have to manage the hypertensive case. So this was a hypothetical case, and it was a very plain case with the no compelling indication, means without any comorbidity. That's why it was little simple to understand, right? Now let's see the another scenario, the another case, right? Let's go to the case number 2. So again this is in the hypertension only. Now here we are having the female patient, right? Now a 58-year female patient with a weight of 62 kg and height of 155 centimeter, right, appeared in the hospital with the complaint of fatigue and blurred vision. She was having the fatigue, easy fatigue and blurred vision. She was having complaint of frequent urination also. She was having complaint of frequent urination, and she was a non-case in the history. While going through her thorough history, she was a non-case of diabetes since last 12 years, and she was having the metformin. She was on the medication of metformin 500 mg. However, she was not a non-case of hypertension in the past, but now she is having little symptoms of fatigue and blood. However, fatigue can be related to the diabetes also, but blurred vision as a complication it may be there, but we may suspect hypertension also, because there are same risk factor for both the conditions. Now in the clinical findings, while searching for the objective evidences, so these were all the subjective evidences. While searching for the objective evidences, what we have got means her BP was also found high, right? Her systolic blood pressure was 162/94 mmHg and her pulse rate was normal. However, now it is indicating that she is having stage 2 hypertension. She is having stage 2 hypertension. So likely she is having hypertension. However, in this case also, we want to just have a confirmation by calling her in follow-up. But as she is diabetic and she is having the higher risk, because she is already having a lot of risk factors for the hypertension, so we will treat it as a hypertension as of now also. So in laboratory finding, we can see that her fasting blood sugar level were 168 mg per dl. You know, normally generally 70 to around 120 it will be there. So it is quite high. So which indicates that she is having poor glycemic control despite of having metformin, and her HbA1c level was also 8.2%. You know, ideally it should be around 5.5. You know, and less than 6. You know, can be considered as a normal. However, this is in the borderline condition. But she is having 8.2, right, which is clearly indicating that she is having, you know, extremely poor control in the glycemia level. So we need to see that, and her, you know, serum creatinine level is also increased. Her creatinine level is also. Now you see what are the evidences we are having. In the subjective evidences, we are having she is having the complaint of fatigue, blood vision, and frequent urination, which are indicating the symptoms of diabetes and hypertension. Then in the history, she was having the history of diabetes mellitus. Right now, that is suggesting that now also she can have a you know, episode of increased glycemia level. Then, but she was not having the history of hypertension. However, when we are examining her blood pressure as of now, so she is in the stage 2 hypertension, and in the objective details, in the additional objective details, her fasting blood glucose was 168 mg per dl. That is quite high, and her HbA1c is also indicating over the months or over the past 3 months she was having poor glycemic control, and even her creatinine level is increased. You know, somewhere we may suspect that now there is an involvement of renal system also. Now in the diabetes, now there is involvement of renal system also. Now here are some questions that needs to be brainstormed. So, which classes of drugs are preferred and why, right? So this is a real case. Previous was the hypothetical case. Now this is a real case we have got in the hospital. Now here, which class of drug needs to be preferred and why? Either we should go with the ACE inhibitor, or we should go with the ARBs, we should go with the calcium channel blockers, we should go with the beta blockers. What should be drug of choice and why, right? Can anyone guess? If you have guessed it correctly, you can mention it in the comments. Right? If not, let's discuss. So here, the drug of choice would be the ACE inhibitor. ACE inhibitor. Why? Means ACE is having side effect related to the pulmonary system. However, there are no any complaints of pulmonary system. So in that way, it is relatively safe. Why we are preferring ACE inhibitor means, these ACE inhibitors will increase the blood flow to the nephron system. Nephron system means in the kidney, and it will have some renoprotective function, right, as there is an involvement of renal system. So we will go with the ACE inhibitor. Along with that, ACE is highly preferred in the compelling indication of hypertension along with the diabetes, and it is having the indication for the renal system also. That's why ACE inhibitor should be our drug of choice. So this is the reason for that. If similar questions you are getting in your examination or during your practical examination, you can justify the same scenarios like this. And what should be our goal, right? Here we need to have 2-3 goals. One goal should be, we need to bring her blood pressure in the normal range. According to her age, her systolic blood pressure can be brought below 140, and her diastolic should come below 90. So that should be our goal in hypertension. And during her metformin therapy, her glycemic level is not in control. Now we want to have a better control of glycemic level. Now either we need to increase the dose or add some additional oral anti-glycemic agent, hypoglycemic agents, or we need to change the therapy. Now our another goal should be, have a better glycemic control. Another goal is the better glycemic control. Now here another point is that she is having the metabolic system disorder also, and she is having the hypertension also. Means her lifestyle should be poor, right? So that's why she might be having all these issues. Now we have to improve her lifestyle also. So that should be our goal. So these 3 can be the primary goal. We can add some more goal if we require. Then glycemic control was adequate? Yeah, obviously no, she was not having the better glycemic control. So as of now, her HbA1c is so high. During her hospital admission, we can go with the insulin for the better control because her renal system is also involved, right? Then while discharged, we can go with the ACE inhibitors along with the oral hypoglycemic agents. Now rather than metformin, we can add one more compound. Like example, we can go with the glimepiride plus metformin. In such way, we could go with the combination therapy so that we can have a better glycemic control. And we will suggest her to get her blood glucose level investigated every month so that we will have a better idea how her blood glucose level is going on. Once her glucose levels will become stable, then we can suggest her every 3 months she can go with the assessment of her glycemic level. So that can be done. Now here, what about complication? Yes, she started developing the complications like increased serum creatinine. She is at the high risk for the complications. Now she needs strict control in the diet. She need to have a discipline, means her lifestyle should be so good, and she need to take the proper drugs also so that the complications can be prevented or these complications can be reversed, right? If she is negligent here, then this keep on worsening and additional complications, some other macro and microvascular complications may also occur. So we need not to ignore the complications, right? Now this is the discussion about this particular case. Hope you have understood this case, right? In this rational way, we can think of this case. Now let's go with the another case, that is case number 3. Now here, a lady, a 26-year-old lady, she is pregnant, right? Now when we are seeing her gravida, we are seeing G1P0, means she is not having any children. However, she is pregnant for first time, and her gestational age is around 24 weeks, around 6 months of pregnancy is having. And she visited in the hospital with the complaint of swelling in the feet. Both her feet are getting edema, and she is having chronic headache also. So she came to hospital, but she was not having any significant medical and medication history, right? When she went through the physical examination, her BP was recorded high. Her systolic BP was 156 mmHg and diastolic was 98 mmHg. So in the previous visit, during her regular checkup during pregnancy in the 12th week, her BP was quite normal. She was having no pedal edema also and no visual disturbances also at that time also. So it simply means now this is a newly induced blood pressure. So we may suspect, some conditions here. Her laboratory findings have suggested that renal and pulmonary function tests are all normal and her hematological tests are also all normal. Only her blood pressure is increased. Rather, everything is well and fine, right? Now, what can be diagnosis? So can anyone diagnose this condition, right? If you have got it correctly, you can mention in the comments, right? Here, what should be her diagnosis? Right, obviously we are telling she is having hypertension. Now here in this case, we need not to wait for another 2-3 months to control the blood pressure, because if it is getting worse in the pregnancy and all, it may lead to the renal injury, which may lead to the proteinuria. Then if there is a proteinuria, this condition is called preeclampsia. And if there is addition of seizure, then it may lead to the eclampsia, which is the major cause of health issues in the pregnancy. So we need not to wait for her follow-up and all. We need to manage her blood pressure in the normal range. So her diagnosis should be gestational hypertension or gestation-induced hypertension, because this hypertension has identified after 20 weeks of her pregnancy. Previously, she was having no any issue. What should be our goal? Our goal should be her blood pressure should be well brought into the normal range, right? As she is pregnant, her goal should be around 130 to 140 इसके बीच में systolic को रखना चाहिए, and 80 to 90 diastolic के बीच में it should be diastolic. So that should be our goal, and our goal is to minimize the possible ADRs also, right? Whatever therapy we are giving, there should be no any ADRs of that therapy, especially to the growing fetus and to the mother also. So that also should be considered while designing or framing our goal. So what should be the drug of choice, right? Can anyone again guess? If you got it, please mention in the comment. If you have not got it, in the theory we have discussed, we are having some safe drugs like alpha-methyl dopa, hydralazine, clonidine. All these drugs we can go, and even the drugs like nifedipine also are safe, comparatively safe than other drugs. However, beta blockers and all should be avoided in the pregnant lady. So we will start with the hydrogen and methyl dopa. So what drugs needs to be avoided, right? As I have I mentioned, some drugs like beta blockers, diuretics and all may lead to the severe electrolyte imbalance. Those needs to be avoided. Counseling, yes, right? We all know that during pregnancy, either these drugs are safe also. Taking a lot of drug is not good for the fetal health and for the mother health. So rather than that, we will suggest her to follow the better diet plan. In the diet plan, she need nutrition in the pregnancy. However, salt needs to be restricted, and we can suggest her some light aerobic exercise, like slow walking she can do, and some light physiotherapy type of exercise she can go. So this should be her counseling point. So in this way, we can manage the hypertension during the pregnancy time also, right? So hope you have got some idea in the case studies, right? If you like the session of case studies, right, please share these things with your friend so that we will meet you in the another class with the another health condition. For now, thank you so much for attentively listening the today's class. Thank you.